Good afternoon, everybody. My name is Dr. Jeff Culbert, and welcome to Schooley's Mountain Chiropractic Center. You know, we really do live in crazy times, because if I'm embracing technology, then you know the world is an upside-down situation. Years ago, before COVID hit, we would do lectures within the office, and one of my favorite lectures to do is known as a Building Health Awareness course, or it's basically welcoming new patients into the clinic. With COVID now, we have not been able to do that, and with the rising price of inflation and the cost of gas, most people don't want to come back out on a Tuesday evening and listen to a healthcare class or an orientation into the chiropractic clinic that you've just chosen to come to. So I am embracing technology. This is one of my forays into YouTube. So if you should like this information, I'm already going to proactively ask you to hit like and then subscribe so we can build our channel so you can find me a whole lot easier in the future. So thank you very much for that. When I have new patients coming into the office, for the most part, chiropractic is going to be rather new to them. And the way that we do things into the office here is quite different from what other chiropractors do. So when you come into the office, you're greeted by our staff on the phone, and they take down all of your pertinent information. That information then gets given back to me, and you come on in for a history and a consultation. During history and consultation, we go over what is the problem, what's been going on, how long it's been going on, how it's impacting and interfering with your life, and then we start to discuss what are your healthcare goals for yourself here in the office. And at that stage of the game, most patients will give me a blank stare. And so I asked them, I said, well, you need to let me know what type of care you're looking for in the office so that I can curtail a treatment plan or a program of care that is going to get you from point A to point B to point C and hopefully eventually to point D in a way that is going to make sense to you. And it is going to make sense to you that there is a progression of care or a process to care here in the office. So first thing I ask is, so what's your goal for care in the office? And everybody says, well, I want to get out of pain. I said, well, that's great, but that is really just the tip of the iceberg. Because when you're looking for relief care, you're basically coming in and you're like a house on fire. There's a lot of pain, there's a lot of inflammation, and you're going to do and say anything to simply get out of pain. But getting rid of the pain, again, is only the tip of the iceberg. Because during the relief program of care, I literally become the fireman. And what I'm doing is I'm pouring water on you to put out your inflammation, to put out your fire. But when that occurs, the goal in that phase of care is to reduce your pain by 50 to 100%. And that typically is going to take anywhere from as little as a couple of weeks, depending on your age, the comorbidities that might be there, the chronicity of the condition, and any other life factors that may delay the process of care, to sometimes as long as 2 to 3 months. So relief care, probably figure you're going to be with me in the office anywhere from a couple of weeks to at least a couple to 3 months. And that's the relief phase of care. And some people will look at me with a blank stare again and say, but isn't that all there is to care? And I will say, if that's what your goal is, but let's look at it this way. If you were a house and you were on fire, and I was the fire department that came to put that fire out, there is going to be some modicum of damage to that house that is going to be going on. And so the question is, do you want to live in the shell of a burnt out house, or do you want to start to repair and rebuild this process or your body or your house so that it is stronger than it was in the past, and you can actually live with the body and not worry about in as little as 3 or 4 weeks to maybe sometimes as long as 6 months to a year or two, that this problem is going to start to repeat itself and repeat itself and repeat itself and repeat itself in such a fashion and a pattern that each time that it does occur, it starts to be a little bit more frequent, the pain is a little bit more intense, and each episode takes a little bit longer to get over. Or do you want to go and correct the problem? Well, when I explain it that way, most people go, well, I want to have the problem corrected. So again, then we start the process of getting you transitioned, okay, into what is known as the corrective phase of care. We do that based on going over a reevaluation, and based on the reevaluation, we start to determine, are you ready for exercises? Are you ready for nutritional, lifestyle modification type of things to start discussing to transition you then from being a burnt out shell of a house to a house that's going to be rebuilt, reconstructed, and to the degree that we can with no underlying comorbidities such as arthritis or disc degeneration, a house that will be as good or better than it was prior to your injury that brought you into our office. So corrective care is going to be somewhere in the vicinity of generally months to sometimes a year, maybe 2 years, depending on, again, the degree of severity that you're coming in with, the comorbidities that are there, things and processes that are going on in your life that are going to either allow you to do more or less the things that we're going to ask you to do to be corrective, such as exercise, nutrition, sleep, watching your posture, maintaining a treatment schedule under chiropractic care, and just knowing that life is an educational process and it is ultimately an endurance race. And so if you wear yourself early on into the race, you're going to wear out, you're never going to be able to finish it. So what we're going to teach you in the corrective phase of care, again, what is the proper type of exercise? Is it basic stretches, strengthening exercises, advanced work? Is it going to be a process? Yes. It is going to start small? Yes. And is it going to be consistent? Yes. And are you going to incorporate cardiovascular fitness? Are you going to incorporate strength training? Yes. Are you going to create balance? Yes. What you do to the right side, you have to do to the left side. What you do to the front, you have to do to the back. What you do to the top, you have to do to the bottom. So exercise has to have balance. Does it have to have endurance component? Yes, because again, if you're going from birth to 100 years old, it is an endurance race, okay? Nobody's going to stop after a couple of weeks. Life is endurance. And from there, we're going to talk about nutrition and what you need to do to be nutritionally healthy. Because there's an expression out there called GIGO, which stands for G-I-G-O, which means garbage in, garbage out. And whether you want to admit it or not, your body is the ultimate productivity tool, best one ever made. Trillions of parts, 98% of the time your body is defect-free until we start to beat it up a little bit. So nutrition, really important to get those building blocks in. Lots of fruits, lots of vitamins, lots of vegetables, lots of water. Those water-rich foods contain nutrients that your body is going to need. Processed food typically tends to have less nutrients in it. So when we're looking at nutrition, I want you to be focusing on water. At least half your body weight in ounces of water a day. I'm going to ask you to avoid as much as you can the sodas, the juices, the coffees, the alcohol. All of those things tend to have sugar and caffeine, and those things dehydrate you. And I want you to be as hydrated as you can. It's great for the way the muscles function. It's great for the lubrication of the joint. It's great for circulation. It's great for lymph and immune system flow and cleansing your body out. It's great for the skin. So please hydrate up as much as you can. The rule of thumb generally is half your body weight in ounces of water a day. If you're doing things, working out, or if it's like today here in New Jersey, it's almost 90 degrees and really humid, and just being outdoors, you're sweating a lot, up that water to as much as 2/3 your body weight in terms of ounces during the course of the day. And if you're not at that level yet and you need to work your way up into it, do it in slow little increments and little chunks. Because when you get dehydrated, your body puts a film onto your tissues, organs, and glands. So when you try to go and superhydrate all of a sudden because you realize you are a little bit dehydrated, that water hits your tissues, there's a film on it that needs time to dissolve, and if you don't dissolve it, it runs right to your bladder, you stretch your bladder, and you're going to be peeing like crazy. So we want to try to avoid that, so we're going to transition in from wherever you're at with the water that you're taking and then build it slowly. We're also going to ask you to try to eliminate as much of the processed foods as you possibly can. The white flour, the sugar, you know those things are no good for you, gums up your intestine, causes your blood sugar levels to flux and go crazy, so the big sugar highs and the sugar crashes. Try to eat as much fresh and organic food as you possibly can. And if you can't get that, at least get frozen food. It's the next best thing. And then the last thing to try to eat is the stuff that's canned. And literally we have a joke in the office that if you're defaulting to canned food, might as well just eat the can and throw away literally what's inside of it, because there's very poor nutritional value to that. When we're done talking about nutrition for you and getting you involved with that for corrective care, so you get the nutrients in, you're doing the exercise, we want to talk about the proper amount of quality and quantity of sleep. And again, it's one of the components that most people tend to say, I can do without sleep, I can get by. Well, the problem is if you get as little as 5 hours of sleep for 5 days in a row, you're classified technically as pre-diabetic. And if you look at Alzheimer's known now as diabetes of the brain. So we don't want to do things that are going to interfere with our blood sugar and create a problem with our biochemistry that way. So we want you to try to get the proper quality of sleep and quantity of sleep. And there's numerous ways that you can do that. If you look back about 100 years ago, 120 years ago, before Edison invented the light bulb, the average person was sleeping about 9¼ hours a day. Compare that today, where we have all the light lights and all the technologies and all the gadgets and the gizmos to keep us informed and in touch with everybody, we are now sleeping about 6 hours and 15 minutes to 6 hours and 30 minutes a day. So if you look at a couple of studies out of the National Sleep Institute, the average person needs a minimum of about 8 hours and 15 minutes a day to as much as 9 to 11 hours a day, depending on your body biochemistry and your body's needs for rest and sleep. So if we should be getting roughly 8 to 9, and we were getting 9 hours and 15 to 9.5, 115, 120 years ago, and we're down to 6 hours and 15 to 6 hours and 30 minutes now, we are easily going into about 2 hours of sleep deprivation each and every day. So I'm going to ask you a question. If you have a baby, what is the one thing you make sure that baby gets enough of? They get enough sleep. And why do you want them to get enough sleep? Because we as parents and grandparents know that if a baby is not getting their sleep, they are going to be cranky. So the question that I ask everybody is, why is it okay to not have a cranky baby, but it's okay for adults to be cranky? So we want you to try to start to focus in on what you have to do to get a good quality and quantity of sleep. So right now, be thinking of at least 8 hours. You know the age-old saying, 8 hours to work, 8 hours to play, 8 hours to sleep. Well, we want to focus on at least trying to maintain that balance. Probably a little bit more, but let's shoot for the 8. Okay? And it's not about sleeping faster, it's about sleeping right. Because especially as we're adults, when kids are growing and they're sleeping, their body produces growth hormone to build strength and size and build their body bigger, stronger, better. For us as adults, when we get to be over the age of 25, our growth hormone levels start to drop dramatically. But they are still being produced, and they're being produced when we get quality and quantity of sleep. And the most important thing for us as adults, that when we produce that growth hormone, it allows us for proper tissue healing and repair. So your body heals best when it's getting its level of rest. Your best stretch of rest is when you are sleeping. So try to remember to optimize that as best you can. If lifestyle situations are that it's just impossible to get the sleep in terms of time that you need, focus then on quality. And there's a number of ways that you can measure quality with a Fitbit band or an Oura ring. But again, measure the quality of sleep and work to try to improve it over time. Ideally, 8 hours of great quality. And great quality is enough REM sleep, but most importantly, where you produce the growth hormone is paying attention to the deep sleep. And in terms of deep sleep, the average individual when they're young needs about 20 to 30% of their sleep to be deep sleep. Unfortunately, as we get older, it tends to be that we're in deep sleep less. So if you can somehow score somewhere between 10 and 20% deep sleep, you're generally getting a decent quality of sleep as you're getting older. Again, we don't need as much growth hormone as when we were younger, but we do want to produce it for tissue healing and repair. The next thing we're going to talk about during corrective care is what you need to do to maintain a good posture, because good posture reduces the stress on your nervous system. The more you can sit right, stand right, and lay down right with good posture, the less stress there is on your nervous system. Muscles stay balanced. They go for support. They go for strength. They keep you moving, okay? They're not maintaining and stressing and straining to hold a faulty posture. The one thing I can tell you is that most of my patients who go through this corrective phase of care and start to work on their posture, and notice their posture is improving over time, start to report is, Dr. Jeff, what have you been doing for me? Because all of a sudden now I have tremendous amounts of energy, and you're recruiting and recouping that energy because you're no longer holding a faulty posture. So again, there's exercises and stretches during the corrective phase of care that we will be recommending so that you can start to lock in a more natural, more normal posture versus a slouching posture. And again, remember, posture always needs to be maintained whether you're sitting, standing, or lying down. So ask yourself sometimes when you're sitting in the car or sitting at the kitchen table or sitting watching TV, just say, hey, let me sit as if I had really good posture right now. And if you had to change your position, The question is, why did you have to? You should have been sitting with good posture right from the start. So now we've covered exercise, we've covered nutrition, we've covered sleep, and we've covered posture. The next thing we want to talk about is your attitude, because truly nobody gets well unless they want to get well. There's a mind-body connection that goes on. So again, we want to make sure that our attitudes are exemplary. You know, I go through a list of affirmations every day, and my affirmations speak to me about the truth that I am now and the truth that I want to be in the future. So I start my day every day with an affirmation. I literally do 18 or 19 different affirmations, but my favorite one is that I am a happy, healthy, vital, active, successful human being. I affirm this day that all tissues, organs, and glands are functioning perfectly in my body, and that is the way it is supposed to be. I'm more relaxed than ever before because I choose peaceful and loving thoughts, release my fears, worries, and anxiety, and tension is gone because I am creating an atmosphere of ease and confidence. My mind is uncluttered because I set specific goals and planned action steps for their accomplishment. I feel better now. Nature uses the food that I eat, the air that I breathe, the water that I drink, and the rest that I get to rebuild, repair, and revitalize me for the future. Radiant energy flows through me. I also affirm this day that money is plentiful, in abundance, and in a limited supply. That this money flows freely and constantly into my life as I render loving service to my patients. I have the right to be successful. I prepare myself mentally and physically to attract all the patients necessary for my success. I accept this wealth because I know in my heart I'm helping others regain their health, the most precious commodity. On this day, I give of myself unselfishly, extending my hand to help others. Opportunities to serve come continually and unexpectedly. So therefore, when I start my day that way, I am covering all the bases. I'm covering my exercise. I'm covering my nutrition. I'm covering my sleep, covering my attitude. I'm covering what my service is to others. That money flows abundantly to me. Remember, health is a state of complete physical, mental, social, economic, and spiritual well-being. You have to have all 5 of those components working for you. So again, it gets to be important to set your mind every day. As human beings, we're bombarded with roughly 60 to 66,000 negative thoughts a day. When you stop to think, there's 72,000 seconds in a day. We are bombarded almost literally every second of the day of some kind of negative thought impacting our health and our well-being. So Dr. Saunauer said there is definitely a mind-body connection, that all back pain is related to what's going on in your head. So we need you to start to think, I am a healthy, happy human being, and that I am in the right place, and that I am going to get well, versus, will I ever get well? Is this going to work? My friends and my neighbors said, I don't know if I should be going to a chiropractor. One of the things that I will tell you is that if you're in the right place and I can help you, I will tell you that. And I will also tell you that if I think you need to go somewhere else or incorporate something else into the game plan of getting you well, we will make sure you do that, so we have all the bases covered. And the last thing that we want to talk about is in our office, what is it to be a good patient? Okay? And that is being as consistent and regular with your care as possible. It's a lot like going to the chiropractor, it's a lot like going to the gym, going to a physical therapist. It's repeated work to start to shift and make your body move into a different realm in a different area. It takes time, it's a process. So at this stage of the game, you should be thinking, how do I maximize my chiropractic care? Well, we're going to lay out a treatment program for you. Initially, for most people, because they're coming in with a moderate degree of severity, stuff that has not been a crazy amount of lifetime care, and they're not bedridden or disabled on their questionnaire forms in terms of disability, we're going to probably start off seeing you 3 times a week for at least the first 4 to 8 weeks. We'll do a re-eval at visit 12 and visit 24, see how we're progressing. We see a reduction in your pain and symptomatology by 50 to 100%. That's a good sign if you're not a senior. Seniors, Medicare allows us to have a little bit more, because they know that there's more chronicity in you, there's more degeneration. They're happy if we see 10 to 50% improvement. So anywhere between a 10 to 100% improvement, depending on age, chronicity of the condition, severity, is a good sign, and it means we're starting to go from relief and transitioning into corrective care. And again, that corrective care can last anywhere from months to sometimes a year or 2, but it is setting and building the foundation for what that next support supportive phase of care is, which we call wellness in the office. And wellness, that's the care that I would love to see everybody under, and that's coming in every week or two, and it's coming in for the rest of your life, although you don't have to, and that's a big misconception that most people have. Once you see a chiropractor, you have to go forever. That's your choice, depending on whether you want relief care, corrective care, wellness-oriented care, or some combination of all of those three. But the beauty of it is then you are now supporting all of that work that you did to correct it, and all of that time and all of that financial investment to rebuild your body. So the question is, once your house is rebuilt, do you let it go back into disrepair? Once your car is fixed, do you let it go back into disrepair? No, you do some kind of regular supportive and maintenance work on your house, to your yard, to your car, to your teeth. So your body really shouldn't be any different. So long-term wellness supportive care gets you into what is known as tropic care. It is when your body stops just surviving and it literally starts thriving. So there's an expression out there when I took my sports medicine course that you hit your peak maximum 100% athletic ability at 25. And then from there, it's a progression each year of losing about 1% a year. So at 60, 62 now, from 25, I've literally lost about 37% of my peak maximum ability. But with regular chiropractic care over the last 40 years, I'm still competitively out there doing Spartan races, Tough Mudders, okay, and city challenges, bone frog events. I work out and exercise every day so that I am keeping myself as physically fit and tropically toned so that I can compete and do things with kids that are half my age. And generally, the old man kicks their butt. Because again, they haven't had the time to embrace the lifestyle of chiropractic. And when you embrace the lifestyle of chiropractic, literally it is what helps to create what is known as super seniors. These are the people who have been following an exercise program, nutrition program. They are watching their sleep, they're watching their posture, they're maintaining an attitude, and they stay under some kind of spiritual connection. They get along with their friends and their peers and their family, and they're under some kind of regular type of chiropractic care or some kind of alternative care such as massage therapy, acupuncture, nutritionist, okay, but they're actively engaged in making sure that they are maintaining their health from cradle to adulthood to grave. And again, we want to implore you to start to think outside the box. Am I only here for relief? Do I want to rebuild, or do I want to support and maintain and experience the thriving that can occur with years of chiropractic care under your belt? So this is a lot to digest and take in a short period of time. I hope you've liked this information. I'm certainly hoping that you're going to like and subscribe so we can build our YouTube channel so we can get it out there to more people more easily. And if you're interested in anything that I have said today and want to know more information about it, then please visit my website, smcc4u.com. Please feel free to drop us an email, get our phone number, give us a call, sign up for a new patient exam, and we can get started with the process of getting you into the office. But again, for everybody else that's out there, most of you guys, I'm going to send this to. All of my new patients will be getting this. Embrace this information. Make it part of your lifestyle. Make it something that you are totally aware of. Literally make it so that it's so much a habit you don't have to think about it in the future, because this is how you get the best out of your care in the shortest period of time and allowing me to help you get better in your healthcare journey. So thanks again. Dr. Jeff Culbert, Schooley's Mountain Chiropractic Center, your leader in alternative healthcare. Have a great day.